A very warm welcome to you all. I am Shivani and I am representing Saveetha Dental College, and today I am going to present a poster on the topic Assessment of Antimicrobial Property of MTA. So, the pulpal inflammation, also called as pulpitis, is mainly caused by an opportunistic infection of the pulpal space caused by oral microorganism. The most common route of entry of these oral microorganism is through dental caries, and the other routes involved include cracks through dentinal tubules and through the main apical foramen. Now, coming to the main aim of endodontic therapy, the main aim of endodontic therapy is debridement and cleaning of the root canal space. And once these two are done, shaping of the root canal space can be done in order to obtain an inert material which will further prevent the chances of reinfection. And the properties of this inert material must include it should be biocompatible, it should be non-toxic, it should have a very good sealing ability, and along with all these three, it should be moisture resistant. In some cases, even after the chemomechanical treatment is done of the root canal system, the bacteria might still harbor to the dentinal tubules, and which will lead to the failure of the conventional root canal therapy. And so by this I mean to say that along with all the properties of the inert material which I listed above, the main property of the inert material should be its antimicrobial or its antibacterial effect. Now, talking about mineral trioxide aggregate, this cement was first introduced by Mohammad Tora Benijad in the year of 1993. And only in the year of 1996, the antimicrobial effect or the antimicrobial property of the material was studied. So, it was known that the material, the mineral trioxide aggregate, had very good sealing ability and it was antibacterial. So, owing to these properties, owing to its chemical and physical properties, it was highly recommended for use in endodontic therapy. Along with the properties which I listed before, one of the excellent properties of mineral trioxide aggregate is its ability to induce the hard tissue formation. So, now talking about chlorhexidine. Chlorhexidine has been routinely used as a disinfectant owing to its broad spectrum antimicrobial properties. And in the early 1960s, the property chlorhexidine was used as an endodontic irrigant, as it has a wide spectrum of wide antimicrobial spectrum, and it is very effective against E. faecalis, the strain which we used for the study. So, various studies have been done on chlorhexidine when mixed with other dental materials, which were a success, and hence the aim of our study was to assess the antimicrobial property of MTA when mixed with chlorhexidine. In this study, we had compared two groups, which include group 1 as the MTA with distilled water and group 2 as MTA when mixed with chlorhexidine. So, in this the study was conducted on double layered plates, in which the base layer of the plate was covered with tryptone soya agar, which was poured in sterile petri dishes. So, a total number of 5 plates were were employed. A sterile swab was used to inoculate E. faecalis on the agar plates to form a lawn of the growth, to achieve a lawn of growth, and then 2 uniform wells of 4 mm diameter were punched in an agar plate equidistant from each other, and the MTA was mixed according to the manufacturer's instructions, which is using 1 gram of MTA with 3.5 ml of water, and the same way chlorhexidine was also mixed with MTA, and as soon as the mixture was prepared, it was transferred to the agar plates, and it was incubated at 37 degrees Celsius for 24 hours, after which the zone of inhibition was calculated using a millimeter scale. Test was used to compare the mean zone of inhibition between the materials used, and the statistical significant differences among the groups were set at p less than 0.05. Now, coming on to the results part, the zone of inhibition of MTA with MTA liquid was found to be higher than that of MTA with chlorhexidine. and the mean zone of inhibition of MTA with MTA liquid was found to be 25 mm, while that of MTA with chlorhexidine was found to be 21.8 mm. And MTA with distilled water has statistically higher zone of inhibition when compared with MTA with chlorhexidine, which is P less than 0.5, which shows the statistical significance. So, in our study, we had used E. faecalis as our prime organism, as our isolated organism, because in most cases of retreatment and in most endodontically treated tooth, this was the most common isolated organism that we found, and about 24 to 77% of the E. faecalis strains were found in endodontically treated tooth, which shows that there are certain virulence factors present in E. faecalis which have the ability to survive the effects of conventional root canal therapy. And once a root canal therapy fails, the surgical intervention comes into limelight. We had employed the Agar diffusion method, which is one of the most employed techniques for testing and assessing the antimicrobial properties. Although there are a few limitations of this method. One includes that it does not distinguish between bacteriostatic and bactericidal effects, and along with the zone of inhibition, it is also related to the diffusibility of the material in the agar. Also, there are other factors which play a role, which includes the inoculum size, the inoculation period, and the incubation period. Although when all these factors are set right, harmonious and homogeneous results may be obtained. So, in the current study, the zone of inhibition of MTA with MTA liquid was found to be higher than that of MTA with chlorhexidine. So, a few studies have been done which replaced MTA liquid with chlorhexidine to enhance its antimicrobial properties, and as per reports, it was suggested that MTA when mixed with chlorhexidine had greater zone of inhibition than MTA when mixed with MTA liquid. So, there are other studies which state that the antimicrobial properties of MTA can be enhanced by incorporating silver nanoparticles. It is known that the antimicrobial property of MTA is due to its alkalinity. So, the pH of MTA when freshly mixed is 10, and after 3 years it increases to 12. So, it is reported that at the pH of 12, it could actually terminate all major microorganisms, including E. faecalis. So, the antifungal activity of MTA could also be attributed to its high alkalinity. Also, in the current study, MTA had its inhibitory effect on E. faecalis, and in a study done by SEMI, it was seen that MTA did not possess any inhibitory effect against E. faecalis. This could be due to the differences in the studies. So, in the present study, we had wells in the agar in which the MTA was MTA was packed in fixed quantities, where in the opposing study, MTA was just inoculated on the surface of the agar. So, this could be due to a few other studies state that enhancing the antimicrobial effect of MTA when mixed with various liquids could adversely affect its other properties like compressive strength, biocompatibility. However, further studies are necessary to evaluate the properties of this mixture. From this study, I would like to conclude that MTA with MTA liquid showed higher antimicrobial effect than MTA with chlorhexidine. Thank you.